test out of IV Start and IV Push Med. 20 minutes to complete both. Okay, so I'm going to go through the supplies that are needed first. So you need an IV Start kit. Okay, and this one has your alcohol pad, a tourniquet, some tape, gloves, but only one size, so you might have to grab different ones, and a gauze sponge. It does not have your transparent dressing that goes over it. So different places have different kits. Some places, like a nursing home, you may make your own. They might not have these kits because it's expensive to have a kit. So they might have tourniquets and everything separate. And sometimes this dressing comes in, but this one does not. So that's part of it. Okay, you also need your IV needles, your IV catheters. So I have a 22 gauge blue and a 20 gauge pink. Okay, and like in reality, when you start an IV, you probably bring an IV basket to the patient's room that has everything in it. Okay, but you always bring a couple extra just in case you don't get it on the first try. You get 2 attempts at an IV stick in real life on a patient, and then you should get another nurse over. Okay, for the test out, you take as many as you need, but you're going to practice this so that you get it. You can try either arm. We have 2 arms here. So IV catheters, we have the hub, which is called a ClearLink System Lure Adapter. Used to be called a saline lock. Okay, so when I put the needle in the patient, I pull the needle out and I leave the plastic sheath in, but it needs a covering, and that is this. Okay, so this, when you use this today, you put your name on it, and you can use this again next time. The rest of the supplies can go. Just like if you're practicing it over and over today, you don't need a new kit. You have your tourniquet, you have your tape, you have all your supplies. Okay, and then you have your pre-filled syringe. This is water, but it's saline in real life. And we have to prime this saline lock. If I don't prime it and I go to flush, you're pushing air into your patient. So we'll prime this to get it ready. And then you have a 3 cc syringe, a needleless needle called a blunt plastic cannula, and your medication. You have a MAR, and we have lots of meds. We can give morphine, meperidine, Ativan, ondansetron, ketorolac, famotidine, and furosemide. All these options. How you need to prepare for the test out, and you can bring this sheet with you. You'll have a new one with different numbers on it. You need to tell me what the med's for, because you could get any one of these meds, and you need to tell me how fast to push it. Sometimes it's 30 seconds, sometimes it's 2 minutes, 5 minutes. So you can work together on this and just put what it's for, how fast to push it. That's what you need to know. That's going to save you time on the test out. If you don't bring this with you to the test out and you've got to look it up, you're probably not going to make the 20 minutes if you've got to look that up. Okay, so I just got an order that I have to put an IV in my patient, gloves as well. Okay, and I need an IV, and I'm going to be giving furosemide to the patient. We don't draw the med up until we're sure we have the IV. So do not draw your med up first and leave it sitting while you're getting the IV, because in real life, if you didn't get the IV, you'd have to toss the med. Okay, so I come into the patient's room and I said, the doctor wants you to have an IV. You're going to be getting some IV for Lasix for your heart failure. Okay, this is the time when the patient says, I have terrible veins maybe. In that case, you could give them a hot pack, a hot washcloth over the vein. That helps to pop the veins up. Okay, if the patient says nothing to you, then you're set to go. You brought all your supplies in. Now, the rule is you should start low. So like in the ER, they do it in the hand. They start the IVs in the hand, because if you started up high in the antecubital and you blew the vein, guess what? Now you can't use anything else in this vein. You could use a different vein, right? Just like if I said, oh, this is a real good one up here. If I blew it, went through it accidentally, now I can't use anything here. So start low is the rule in reality. For test out, you use whichever one that you want. You know, the more holes you see, that's probably a good one to go into. Okay, you can turn the arm either way. There's veins on both sides. Okay, some people have, well, you know, I'm sure you've had blood drawn before. Maybe you have good veins or you have tiny veins that are hard to find. Hydration, if the patient's dehydrated, not gonna be able to find a vein, okay? So have them drink some water if that's the case. So now I prep everything. I'm gonna open up my kit, and we don't wanna put the tourniquet on. It should only be on for a couple minutes. So I open up my kit. There's things we don't need in here, like the betadine and the Band-Aid. Keep whatever you want out of the kit or toss it. Okay, I'm gonna open up the dressing. It's a Tegaderm clear dressing. I do have a 2x2 in here. And now I'm gonna prime. This is the only really sterile part of the procedure. Okay, and this is your first time with these flushes. That one just came right apart. Which it should not, it should still be all together. Okay, when you open it, there's air in here. You must get the air out, okay? And you should pull back first. If you just push, you're gonna hit the ceiling with it. So, pull back, and then mine already came out, so this will be a little more struggle than usual. That's what happened. But mine had come apart. Must get the air out, okay? I'm gonna hold it and keep it sterile. I need to flush the tip of this saline lock to prime it. If you don't, again, you're pushing air into the patient. Sterile to sterile, not the blue end, okay? I don't have to clean it, but I push and twist, okay? And just push a little drop through. It's primed, now it's primed. You still have to get it ready. People forget this. If you forget this next step, you're gonna have blood gushing and be struggling. Take off the blue cap. This is what's gonna go into the catheter, but it needs to stay sterile, so you have to keep it in something. You can't lay it down. I primed it, I've taken the cap off, it's sitting here. I'm gonna open up my IV catheter. You can do your math for your med ahead of time. If you wanna do the math, that's fine, just don't draw it up. Okay, and so now I'm ready to start my IV. So the tourniquet is a skill in itself. You can take the tourniquet home. It's the only thing you can take home from here. Practice tourniquet on each other, okay? Because the tourniquet is a skill. Okay, so if I'm going up here, I put the tourniquet here. If I'm going in the hand, you do not put it this high. It needs to be 6 inches. So you would put the tourniquet here. The purpose of the tourniquet is to cause that vein to pop up. So I'm gonna go with a higher vein. Okay, and this is how you're gonna make a quick release. You pull, crisscross, and tuck. You're not tying your shoes. We want a quick release. Okay, if you were to do it like you're tying your shoes, first of all, it is harder. It's gonna hurt the patient. You're gonna pull their hair, and it doesn't pull off easy. So this is skill number 1. Again, pull, crisscross. If the patient says it's way too tight, then you should release it for them. Put the tourniquet on, and now I need to clean my site with the alcohol wipe that should be in here. It's not in here, so we have to have alcohol separate. Some of them have a little ChloraPrep where you crack the wings and you clean. So grab an alcohol up there when you do, okay? So we're gonna clean our site. You need good lighting. You need to raise this table to your height. In the patient's room, you raise the bed. I'd put their arm on a pillow, and maybe with the chucks if you had the time. Sometimes these come with a little drape inside to put under, but they need to be on some kind of surface, not laying in the bed like this. So I clean the site for 30 seconds, and then I let it dry. Okay, and then these are going to be the important steps once I put the needle in. You're looking for a flash of blood. Once you see a flash, you advance the catheter, you pull the tourniquet, you apply pressure, you pull the needle out, okay, and then you insert the cap, the hub, called the hub. Those are the critical steps of the test now, okay? So I cleaned my site, it dried, okay? Bevel up, bevel is the hole, okay? So we have the bevel, this is the barrel, there's kind of a grip on the side where your fingers go. And we're not going in like 45 or 90. It's 5 to 15 degree angle, parallel with the skin. If you go like this, you're going to poke through the vein. Okay? In real life, you pull the skin taut. You tell them they're going to feel a pinch. You go in at a 5 to 15 degree angle. And if you're in the vein, you'll feel it take off. Okay? Steps. I see a flash. Once I see a flash, you advance the color part only, not the whole thing, or you poke through the vein. Okay, so I advance the color part only. So one hand holds this still. I advance the catheter till you see no more white. Okay, I pull the tourniquet. Okay, I apply pressure. In real life, it's not going to stop it on the mannequin, and on the patient, it really will. And I get this right. I pull the tourniquet, I apply pressure, I pull the needle out. There's a safety, should be on it. And now I insert that fast because he's just going to keep gushing. And now I have to tighten this. Okay, not the whole thing. Don't let the whole thing spin. Hold the colored part, tighten this. Okay? And insert the hub, which I did, and now flush. That's the next stage. It should flush. If it's not flushing, you're not in the vein. I can aspirate to get a blood return. I got a blood return. Okay, you can flush the whole thing or part of it. So those are the steps. And then don't twist the whole thing off. You only want your syringe to come off. Okay, and now these can go right into the sharps. Now I clean up around the skin because that dressing's not going to stick if it's messy, and you don't want the patient to look messy. These have some directions on them. Just read them. It says remove this paper. Okay, and then you angle this so it's centered on your catheter. Press it down. The green paper comes off next. And the two blue come off after that. It should be nice and neat. It didn't come off real neat. I got my IV in. It's flushed. I'm going to give furosemide here. 15 milligrams is given. It comes as a 10. So I need 1.5 ml. Okay, so with your thumb, you flip off the cap after you've done your checks. Furosemide, it comes 10 milligrams per ml, 10 milligrams per ml. The date is 2027. It's not expired. It's new. I don't have to clean it. Hospital policy varies. Sometimes they want you to clean it anyway. So depends on hospital policy. Sterile to sterile, I have to put my cap, my needleless needle. We don't use needles, we use needleless needle. Sterile to sterile. Twist. If you don't put it on tight enough, the medication leaks out. Rainbow off, but it's really not a needle anymore. I'm giving 1.5. I pull up 1.5. Center it. Hard to push in unless you get centered. Push, flip, and it should. This is why we put air in, because in a vial that's never been used, it will just automatically come out for you to the right amount. Okay? I'm going to draw a little extra, pull it off, shoot the med up till I'm right at 1.5. I can recap this. It's not a needle. I can recap this, label it, okay? And now I'm giving the medication. If the IV's been in already and I'm just coming to give a med, I have to flush with saline first. But I was just here, I just put the IV in, I don't have to do that. I do have to clean the site, so I will take my alcohol. This is your furosemide. What is your name? Caroline Brown, date of birth, 5/1951. Do you have any allergies? No. This is your a diuretic. This is going to help pull water off your lungs or your legs, depending where. Don't need the needle on here. Okay, I've cleaned with alcohol. I push and twist, but you have to be delicate with this. You could pull your IV out and then you got to start again. Or if I bump my finger, I'm done, I got to start again. Okay, push and twist this on. And I know I have to give this over like a minute and a half, depends on the dose. So with my watch, I just kind of, okay, and I wait till watching the clock, and we'll say it's a minute and a half. I twist off, I toss, and I end with a saline flush. Okay, saline, med, saline. If I don't flush it at the end, it clots off and the next person does not have access to the site. They have to start the IV again. Okay, and now I'm going to document on my MAR the medication that I gave. I'm going to write a note on the test out sheet on the IV I started. I inserted a 20 gauge in the left forearm. We don't name the vein. Left forearm, patient tolerated well, no redness, drainage, or swelling. That's my note. Okay, and then since this is Lasix, you know, I would have listened to lung sounds first if they had crackles. And then I'll listen again in a half hour because IV works in about 15 minutes or so. Okay, if they had edema, they're going to start peeing more. I'm not going to see the edema go down so fast. Okay, and that is the end of that test out.